Hello, my name is Afton Brada, and today I'll be presenting my population health project focused on reducing hypertension in Anson County, North Carolina. First, let's begin with defining hypertension. Hypertension, often referred to as high blood pressure, is a chronic medical condition where the force of the blood against artery walls is consistently too high. When this happens over time, it can damage arteries and vital organs such as the heart, kidneys, and brain. Many people with hypertension may not even be aware of this diagnosis, and it may have no symptoms, which is why it can be referred to as the silent killer. According to the American Heart Association, a diagnosis is made when a person regularly has readings of 130/80 or higher. The importance of detecting and managing hypertension early cannot be overstated. Effective control can significantly reduce the risk of stroke, heart attack, heart failure, and even dementia. This makes hypertension one of the most critical conditions for public health intervention. Pictured here to the right, you'll see the American Heart Association guide for classifying and categorizing levels of blood pressure. Anson County has one of the highest hypertension prevalence rates in North Carolina. According to the 2025 County Health Rankings, approximately 43% of adults in the county are affected. This is well above the state average of 37% and the national average of 32%. These numbers are concerning, particularly for a rural community with limited healthcare access. The higher prevalence may reflect a combination of social determinants of health, such as limited transportation, lower income, inadequate access to healthy foods, and these environmental and lifestyle factors create a community where hypertension becomes the norm rather than the exception. It's not just about individual behavior, it's about the broader systems that support or hinder health. Anson County is located in the southern Piedmont region of North Carolina, and according to the United States Census Bureau, has a population of around 22,000 people. It is predominantly rural, with a significant portion of the population living in medically underserved areas. Demographically, the population is diverse, with African Americans making up approximately 50%. Many residents are older adults or individuals living on fixed or limited incomes. These groups are more likely to suffer from chronic diseases like hypertension. According to the North Carolina Department of Health and Human Services, many Anson County residents face barriers to healthcare access, including limited provider availability, long distances to facilities, and these geographic and demographic challenges must be factored into any effective public health intervention plan. When we look at hypertension by age group within Anson County, the data shows that older adults are disproportionately affected. Individuals aged 45 and older experience the highest rates of high blood pressure, which is consistent with national trends. This aligns with what we know about aging and vascular health, that over time, arteries stiffen and blood pressure naturally increases. However, in Anson County, the rates are even higher than the norm for these ages. This suggests that other factors, such as diet, chronic stress, and access to preventative care, might be accelerating the onset and severity of hypertension in this population. Several contributing factors help explain Anson County's elevated hypertension rates, such as obesity, which is a major one. More than 35% of adults are classified as obese. Smoking is another big issue, with over 22% of adults using tobacco regularly. Add to that the lack of access to healthy food, which Anson County includes multiple food deserts where fresh fruits and vegetables are scarce. There's also a notable shortage of healthcare providers, especially primary care physicians and nurse practitioners who are critical for chronic disease management. Finally, transportation barriers further restrict access to ongoing care and medication management, and all of these factors compound and reinforce one another, creating a cycle of preventable disease and worsening outcomes. The health and economic consequences of uncontrolled hypertension are substantial. Residents are experiencing higher than average rates of heart disease, which leads to frequent hospital and emergency department visits. According to the North Carolina Department of Health and Human Services, the total estimated annual economic burden of hypertension-related care in the county is around $8.5 million. This includes both direct medical costs, such as ER visits, medication, hospital stays, and indirect costs, like lost productivity and caregiver strain. This burden falls not only on the individuals and families, but also on the local healthcare system and public resources. And here to the right, you'll see, as previously mentioned, the Anson County rates of health indicators such as obesity and smoking compared to that of the U.S. average. Currently, several resources are in place to help mitigate the hypertension crisis in Anson County. The Anson County Health Department provides blood pressure monitoring and educational materials. Atrium Health Anson offers inpatient care and occasionally hosts wellness events, and faith-based organizations like First Baptist Healthy Living provide community-driven support and lifestyle guidance. Additionally, Anson Regional Medical Services offers medication education programs, and while these efforts are commendable, they often operate independently and may not be reaching those who are most in need. Moreover, services may be scheduled at times or locations that are not accessible to working individuals or those without reliable transportation. Despite the presence of existing services, there are critical gaps that limit their effectiveness. Many programs do not adequately reach the uninsured or underinsured populations. Therefore, there's also a lack of culturally appropriate education tailored to African American and Hispanic communities. Home blood pressure monitoring devices are not commonly distributed or subsidized, which hinders ongoing self-management. And transportation remains a barrier, particularly in more rural parts of the county, and follow-up care is inconsistent or completely absent in some cases. Closing these gaps requires coordination, community buy-in, and investment in more flexible, patient-centered solutions. In response to these challenges, this project has identified 3 key objectives. First, to reduce hypertension prevalence in Anson County by 10% over a 3-year period. Second, to increase screening participation by 20%. And third, to improve blood pressure control among those diagnosed by at least 15%. These targets are grounded in feasibility and best practices from successful community health models. Achieving them would not only improve health outcomes, but also reduce healthcare costs and improve quality of life for many residents. To achieve these goals, I'm proposing the Community Hypertension Outreach Initiative, or CHOI. This program is designed to meet residents where they are. Literally, we will implement mobile blood pressure screenings in churches, grocery store parking lots, and other central locations. Participants will be provided with home blood pressure cuffs and clear, easy-to-follow instructions. Nutrition and stress management workshops will be tailored to the cultural preferences and needs of Anson County residents. Text message reminders and follow-ups will help promote adherence and continuity of care. This is a practical, scalable intervention that leverages existing community assets. The success of CHOI depends on collaboration. Stakeholders include the Anson County Health Department, Atrium Health, local churches that already play a trusted role in residents' lives, and the initiative will rely on advanced practice registered nurses for leadership, coordination, and clinical training. Funding will be pursued through North Carolina grants as well as external sources such as the Duke Endowment, which actively supports rural health initiatives throughout the Carolinas. With shared responsibility and aligned incentives, this program can be both effective and sustainable. Equity and inclusion are core to CHOI's design. Cultural considerations include offering materials in both English and Spanish, collaborating with faith-based leaders as ambassadors, and hosting events at times that are convenient for working adults and parents. Transportation vouchers or mobile vans will help residents get to events or receive services at home. Accessibility and cultural sensitivity will ensure that the intervention reaches those most in need and is truly reflective of the community that it serves. To evaluate the success of this initiative, we'll track several key outcomes: the number of blood pressure screenings performed, the percentage of participants achieving a blood pressure reading below 130/80, and attendance at our educational workshops. Data will be collected through EMR reviews, community event logs, and participant surveys to assess both clinical results and participant engagement. We'll conduct biannual evaluations over the 3-year period, allowing us to monitor progress and make data-informed adjustments. Our evaluation process is based on the CDC's Hypertension Management Program Toolkit and will help us ensure accountability while sharing outcomes with local health boards, stakeholders, and to the public. And these are my references. Thank you.